Hello, friends and patients. Dr. Pierre here, and I'm going to talk to you about the 5 tools you can use to treat an opioid addiction. Now, I have to be brief because at a later time, I will provide a lot more details about each of these tools. Now, in my clinic, I provide a combination of 2 to 4 of these tools for my patients. I found that in some individuals, one tool is better than the other, and in others, I'm employing 4, 5, 6 different tools. But it's whatever the patient needs to be successful. Now, I'm specifically calling them tools because that's what you really have to think about when you're in treatment. What tools are you going to use to be successful? So let's get started with the first tool. The first is Methadone. It's probably has one of the longest track records when it comes to medication-assisted treatment. In case you're not aware of how treatment is done, legally in the United States, methadone for opioid addiction can only be provided at a licensed methadone clinic. It requires that you have to go, at least initially, daily to the clinic for your treatment, and eventually they can extend that time frame for, I've heard, up to 3 weeks. Now, the downside, of course, is you have to stand in line. To my knowledge, I don't think any insurance plans cover methadone, and methadone itself could be abused. The next one that is finding a much greater utility in my clinic is extended release naltrexone. Now, the typical naltrexone comes in either a tablet form that you have to take every day, or Vivitrol, which is the extended injectable type. Now, the great thing about Vivitrol is that you give one shot and it's working for 30 days. Now, in those 30 days, if you or whoever receives the shot attempts to use an opioid, the opioid just won't work. Vivitrol will block the receptor, and you just wasted your time and effort trying to get drugs. Now, there are several downsides with Vivitrol. Number one, you have to be off of opioids at least 7 days. If not, Vivitrol will send you into a precipitated withdrawal, and really very difficult to rescue you out of that. Number two, it's very expensive. I've looked into buying it for a patient. It was $1,700 for my costs. And with coupons from the Vivitrol manufacturer, I was able to help this patient bring his costs down to $750 per month. But that could be very expensive for somebody. But you have to weigh your options: Vivitrol or breaking the law. Now, probably the bulk of my treatments are for patients seeking Suboxone. Now, Suboxone is a trade name for the combination of buprenorphine and naloxone. There's also Subzol, there's a bunch of different versions, and there's also Subutex, or just buprenorphine by itself. The name of the trade names isn't as important as what this drug does. So first of all, the buprenorphine, it's a partial agonist. It provides similar effects to an opioid, but at the same time, it's a blunted effect. In very rare situations can somebody get high from buprenorphine, and the naloxone, which is an opioid blocker, is added to prevent patients from abusing this particular drug. Now, it too is pretty expensive. I think a film can cost you anywhere from $10 to $15 per film. Most people will need 1 to 2 films per day. But I think for the overwhelming majority of my patients, they really like this treatment. And the good thing is once you're in maintenance, you're visiting your doctor once a month. So this is a very good option if you're looking in terms of treatment. But let's think about the situation where you don't have much money. Now, Clonidine, it's another old drug. Now, you may know Clonidine as a blood pressure medicine, but in the jails, in rehab centers, Clonidine has tremendous usage when it comes to treating opioid detox. Now, what it does, it relieves your anxieties. It helps you sleep. It reduces a lot of these withdrawal signs. Now, of course, it's not too effective. I mean, if money is the problem, Clonidine only costs $4 per month at Walmart. But it still requires a person who will either detox from the opioid that they're using or taper over, I don't know, a couple of days, couple of weeks. But this is the drug that you should look into if you are doing everything you can and you've tried cold turkey and it didn't work. Really, Clonidine is a very good, cheap option. Now, the last tool would be 12 Steps program. You may know them as Alcoholics Anonymous, Narcotics Anonymous. Now, the one thing I have to say about this particular tool, it really doesn't have much of a success rate. And I don't want to overly criticize 12-step because for some individuals, it has been tremendously effective. But if you remember what I said earlier on, these are tools. So you have to decide which tool you're going to use. The good thing about 12 steps is that they're free. And you can show up whether you are intoxicated on your substance or you're withdrawing from your substance or you've been sober from your substance. They welcome you as long as you have a willingness to quit the substance that you're using. Of course, the downside is that 12-step doesn't do anything to help the symptoms of withdrawal. And but in my clinic, I found that in some individuals, they thrive if I put them on Suboxone, Clonidine, and 12 steps. Others, Suboxone alone, they thrive. So I want to remind you guys, when I decided to give you this video, the whole purpose is to help you become functional and law-abiding. So these are 5 tools. Like I said, I provide 4 of them. I don't have a methadone clinic, so the other 4 are some of the techniques I use. But I hope this video was very helpful to you. And if you found it very useful, please give me a thumbs up.